This is Dr. Surindher. I am Director of Aesthetics Plus Clinics. Welcome to our channel. Everybody, welcome back to our channel. We had another query from one of our viewers asking what exactly is a non-implant breast augmentation or a breast augmentation or a breast enlargement without an implant. So breast augmentation without an implant basically means the same thing. It is basically fat grafting for augmentation. So this basically involves harvesting fat from your tummy or your thighs or your lower back and filtering the fat and injecting the fat back into the breast to increase the volume. So it is basically an augmentation, and but instead of an implant we use your own fat. The advantages of this being that one, it is your own tissue, so it doesn't react, and second thing is because we are just injecting the fat, you don't have long scars, and of course the third being that you can still repeat it again if you need more volume. Now there are certain cons about the procedure as well. One is most of the patients who come in for an elective breast augmentation are young and they do not have too much of fat, so there is not enough fat for us to harvest and to inject it in. Second is fat. If it is fat grafting, if it is done in a younger individual, then once you get pregnant and when you're going in for breastfeeding, the glands are enlarging. So as the glands enlarge, they replace the fat. But once you stop breastfeeding and the glands involute back, the fat doesn't come back. So then you will still have a sag and you might have to repeat the procedure once you're finished with your family. The third and most important is that you cannot put too much of fat in one place in one go, because as you inject fat, you're injecting fat into which is free, which is taken from another place of the body, and putting it into the breast. So your body needs to give it blood supply and hold it so that the fat survives. If the fat doesn't get its blood supply, then it will get absorbed or it will die in the body. So if you put too much of fat in one place, then you will not be able to allow the full survival of all the fat. So if you put about 100 grams, there might be only 60% of it that will survive. So to increase the chances of survival, we try and put small droplets all through the breast in multiple layers, stack it upon each other, so there is enough contact between the fat and the normal tissue to allow that blood supply to be established. And second thing is also the tension. So if you put too much in one small area, then the tension increases, which also hampers blood supply. It is like putting too many people into one room. So the weaker ones or the ones in the center will suffocate and die. The ones in the periphery, which are closer to maybe clean air, they might survive. So it's the same way that you try not to put too much. So you might have to do a second sitting later on, depending on the amount of increase that you're looking for. The fourth is that because fat is soft, you will not get a perky look of the breasts. You will get a more natural look, you will get a more wider look, you will get a more normal fall of the breasts, but you will not get that young perky look. If you are looking for that, then I think implant is your best choice rather than a fat grafting. So a non-implant augmentation is basically a fat grafting. So fat grafting can be fat grafting alone, or it can be fat grafting combined with stem cells. So that's another different topic. So we'll discuss about that in another video. Thanks for watching.